If you're 64 or older and feeling overwhelmed by Medicare, what I'm about to share with you could save you from a costly mistake that might haunt you for the rest of your life. Picture this: you worked hard your entire life, paying your taxes and paying into Medicare, but now you're faced with a maze of options so complex it makes your head spin. One wrong turn, one missed deadline, and you could be bleeding money for years to come. It happened to my own mom. She felt lost, anxious, and didn't trust the government system. Her fear and confusion led to a decision that's costing her an extra 30% on her premiums every single month for the rest of her life. That's thousands of dollars down the drain year after year. But here's the kicker: it didn't have to be this way, and it doesn't have to be this way for you either. Whether you're just approaching Medicare age or you've been enrolled for years but still feel confused. Hi, I'm Callie Navarese, a licensed insurance broker and certified Medicare expert. I've made it my mission to help people just like you navigate the complexities of Medicare. In the next few minutes, I'm going to share invaluable insights that could save you from costly mistakes and help secure your healthcare future. You'll discover a critical error that silently drained the savings of thousands of retirees and how you can avoid it. Essential enrollment periods that you absolutely can't afford to miss, no matter your age. And a foolproof method for selecting or adjusting the Medicare plan that perfectly fits your unique needs. Stay with me, because by the end of this video, you'll have the power to make Medicare decisions with confidence, potentially saving yourself thousands of dollars and countless sleepless nights. Don't let Medicare confusion steal another moment from your hard earned retirement. Whether you're new to Medicare or you've been enrolled for years, your future self will thank you for the next few minutes of attention. But before we get started, please be sure to like this video and subscribe to our channel. We're on a mission to help as many people as possible avoid costly Medicare mistakes. And your support helps us reach more people who need this crucial information. Let's dive in. Let's face it, Medicare is complicated, but understanding it is crucial for your health and financial well being. So let's break it down. First, you've got Part A for hospital care. Think of this as your room and board at the hospital. Then there's Part B for doctor's visits, outpatient care, and medical equipment. This is your day to day medical coverage. Part D is for prescription drugs, and without this, you could be paying full price for your medications. And then there's Part C, also known as Medicare Advantage. This is an all in one alternative that bundles Parts A, B, and often D, sometimes with extra benefits like dental and vision care. Sounds straightforward, right? But here's where it gets tricky. Each of these parts has its own rules, costs, and coverage limits. And that's just the tip of the iceberg. I've seen it happen far too often. Good people, hardworking Americans who thought they were covered, suddenly facing thousands in unexpected medical bills. Why? Because they chose a plan that didn't fit their needs, or they didn't understand the coverage limits. The stress, the anxiety, the fear of making the wrong choice. It can be overwhelming. I've seen it on the faces of countless seniors who have come to me for help. But it doesn't have to be this way. You worked hard your whole life. You deserve a retirement free from healthcare worries. And you deserve to understand your options, to have a plan that truly fits your needs and budget. And that's exactly what I'm here to help you achieve today. So let me share some real life stories that illustrate just how critical your Medicare choices are. These aren't just stories, these are real people, maybe even your neighbors, who are suffering because they didn't understand their Medicare options. First, there's Jan. Jan thought she had decent coverage with her Medicare plan, but when her doctor prescribed a specialty medication for her rare condition, she was shocked. Her plan didn't cover it adequately, and she was looking at costs of over $1,000 per month for one medication. Jan had to make the heartbreaking choice between her medication and paying her rent, all because she didn't understand how to choose a plan that covered her specific needs. Then there's my own mom. She felt overwhelmed by the complexity of Medicare and didn't trust the government to guide her correctly. So she put off enrolling until she was 68. Big mistake. Now she's paying a penalty on her premiums every single month for the rest of her life. That's an extra 30% every month she'll never get back, all because she missed her initial enrollment period. Now, as if Medicare isn't complicated enough, there are big changes coming to Medicare in 2025 that you need to know about. These changes can significantly impact your healthcare costs and coverage. First, a new $2,000 annual cap on out of pocket prescription drug costs will be implemented, and this could mean many seniors save thousands of dollars each year. The coverage gap, often called the donut hole, will be eliminated. No more confusion about when your coverage changes mid year. Insulin costs will be capped at $35 per month for a 1 month supply under Medicare prescription drug coverage. So, for those managing diabetes, this is huge. Recommended vaccines will be available at no out of pocket cost, and a monthly payment plan option will be available to help manage prescription drug costs. This could be a game changer for budgeting your healthcare expenses and for those that are taking expensive medications. These changes all sound great, right? But here's the catch. Navigating these new benefits and ensuring you're taking full advantage of them will require expert guidance, and that's where I come in. But before we get to that, let me share one more critical piece of information. In this complex Medicare landscape, scammers are having a field day. Let me tell you about Dan. Dan thought he was being proactive when he responded to a call about Medicare enrollment. The person on the other end sounded official, claiming to be from Medicare. They pressured Dan into buying a plan that didn't meet his needs and even sold him a life insurance policy, which is completely against Medicare regulations. Dan fell victim to a shady agency that took advantage of his trust and his confusion. Dan's story is just one example of the many Medicare scams out there. Here are some other common ones to watch out for. First, unsolicited calls claiming to be from Medicare. Remember, Medicare will never call you out of the blue. Second, offers of free medical equipment or services. These are often bait to steal your Medicare number. And third, pressure to make immediate decisions about your coverage. Legitimate agents will give you time to consider your options. Fourth, requests for your Medicare number from unknown callers. Guard it like you would your Social Security number. And lastly, too good to be true Medicare deals. If it sounds unbelievable, it probably is. And remember, it's illegal for agents to sell you unrelated products like life insurance during a Medicare enrollment. If someone tries this, it's a major red flag. Now, let's break down your Medicare options. Option 1, Original Medicare, Parts A and B with a Part D plan. And I'll be honest, I'm not a fan of this option for most people. Here's why. If you're hospitalized for just one night, you're looking at a $1,632 deductible for one night. And it doesn't stop there. You'll be on the hook for 20% of all of your medical expenses: wheelchairs, chemotherapy, radiation, you name it. There's no cap on what you have to pay. Option 2 is a Medicare Advantage or Part C plan. This option builds on Parts A and B, often with a $0 premium and some added benefits. Sounds great, right? Well, not so fast. Yes, there's a maximum out of pocket limit, averaging around $4,750. But here's the catch: you're restricted to networks. You'll have copays, coinsurance, and you might need prior authorization for treatments. So if you value your freedom to choose any doctor or hospital, this might feel like a pair of golden handcuffs. Option 3, Medicare Supplement or Medigap. Now, this is what I like to call buying your freedom. Yes, it comes with an additional monthly cost, typically around $140, but after paying your Part B deductible of $240, you're done. No networks, no copays, no restrictions. You're free to see any doctor, visit any hospital that accepts Medicare. It's peace of mind in its purest form. The choice you make today will impact your health and finances for years to come. And here's the good news: you don't have to navigate the Medicare maze alone. You don't have to end up like Jan, struggling to afford medications, or my mom, paying lifelong penalties, or Dan, falling prey to scammers. As an independent insurance broker, I'm not just another cog in the insurance machine. I'm here to be your personal Medicare guide. So, what does that mean for you? Well, for starters, unbiased advice. Unlike agents who work for specific insurance companies, I'm not tied to any single insurance company. So my loyalty, it's to you and you alone. I have access to a wide range of Medicare plans, allowing me to find the right fit for your specific needs and budget. I'm not here to just sell you a plan, I'm here to help you find the right plan for you. Next, expert knowledge. I've mastered Medicare's complexities through specialized training and continuous education. I'll translate confusing insurance lingo into words you can understand and act on. And future proofing. The Medicare world is ever changing. I'll ensure you're not just ready for the 2025 changes we discussed, but you'll be positioned to benefit from every new opportunity. Lastly, fraud protection. I'm your shield against Medicare scams. In fact, I'm leading efforts to expose major agencies involved in unauthorized ACA enrollments. This commitment to fighting fraud means you're partnering with someone dedicated to protecting your finances and your rights. My expertise helps you navigate both the current Medicare landscape and prepare for future changes. I'll ensure you're in the best position to take advantage of new benefits as they roll out. Think about it. Jan could have found affordable medication coverage. My mom could have avoided lifelong penalties. Dan could have been protected from scams, and with me by your side, you can avoid all of these pitfalls and more. Don't let Medicare confusion steal another moment from your retirement. Let me be your guide, your advocate, and your Medicare expert. Together, we'll secure the coverage you need at a price you can both afford now and in the future. Your peace of mind is just one conversation away. So, what does working with a Medicare expert like me really mean for you? Let me show you. First, I take the time to truly understand your unique health needs, budget constraints, and personal concerns. Through targeted questions, I uncover potential issues before they become costly mistakes. And I guide you to the plan that fits you best with my personalized Medicare guidance. You'll understand all your Medicare options clearly, avoid costly penalties and enrollment mistakes, and find a plan covering your specific health needs and preferred doctors. Maximize your benefits while minimizing costs. Stay protected from scams and misleading information. Let me break it down. First, you get a customized plan selection. No one size fits all solutions here. We'll look at your specific health needs, your preferred doctors, your prescription drugs, and your budget to find the perfect fit. Second, my clients often save thousands per year. Imagine redirecting those healthcare dollars and enjoying your retirement instead. Third, you get peace of mind. No more second guessing or sleepless nights. You'll know you've explored every option and chosen the best one for you. And fourth, lifetime support. Medicare changes, and so do your needs. I'll be here to answer your questions and help you adjust your coverage as needed year after year. Now, you might be wondering, this sounds great and all, but what's the catch? Well, I've got some exciting news for you. I provide a free, no obligation Medicare consultation to help you get started on the right foot. Here's what you'll get: a comprehensive review of your current health situation and future needs, a side by side comparison of Medicare plans available in your area, personalized recommendations based on your unique circumstances, step by step assistance with the enrollment process. And remember, this consultation is completely free. But that's not all. I provide lifetime support for all your Medicare related questions. Whenever you have a concern or question about your coverage, I'm just a phone call away. The consultation, the ongoing support, it's all designed to give you complete Medicare confidence. No more stress, no more confusion, just clarity and peace of mind. Now, here's the thing: Medicare has strict enrollment periods. Miss them, and you could be facing penalties or gaps in coverage. That's why it's crucial to act now. Think about it. In just one consultation, you could gain the knowledge to make Medicare decisions that will benefit you for years. Isn't your peace of mind worth a simple phone call? Call the number on your screen or click the schedule your free consultation button below. But don't wait. My calendar fills up fast. Look, I know Medicare can be overwhelming, but you don't have to face it alone. Let me be your guide, your advocate, and your Medicare expert. And together, we can ensure you get the coverage you need at a price you can afford. Again, don't let Medicare confusion steal another moment from your retirement. Call now and take the first step towards Medicare peace of mind. Your health and financial future are worth protecting. So let's do this together. Thanks for watching.